I was thinking that I was on top of the world. I was keeping myself in shape. I was taking care of myself mentally, physically. My relationship was solid. And now suddenly everything changes and I'm not able to work out anymore. And I might not live as long as would otherwise be expected. So these are all things that were emotional shocks for my wife and I to learn. So when I was in the military out in California, during a routine medical examination, they discovered that I had atrial fibrillation.
Atrial fibrillation is a rhythm disorder of the upper chamber during which the upper chamber lose the mechanical function, so they don't contract.
So after my third ablation, the cardiologist that I have out in Denver, they looked into alternatives for where I can go across the country, and they were saying, you know, we've done the best we can. We don't want to take any more risks than we feel comfortable taking. We're going to send you to the best guy that we have in the country. And so they sent me down to Dr. Natali.
Ryan came to us from Colorado after multiple failed procedures, and we sort of were the last option for him. The typical age of a patient with AFib, atrial fibrillation, is about late 50, early 60. So Ryan is clearly an exception, but you know, this is a genetic disease, and unfortunately, because the heart, the upper chamber are not contracting, atrial fibrillation can increase the risk of stroke and heart failure. Recently, after he has been in sinus since the procedure with us for more than a year, we consider to close the appendage mechanically with a Watchman device.
13,000, please.
The appendage is the area where clot, the cause strokes, can form. And if we have to ablate that area to effectively treat atrial fibrillation, to get them off the blood thinner, we close it. And there are two ways of closing. One with a plug, which is the Watchman, which is like imagine an umbrella that springs out at the opening of the appendage and close it.
To eliminate my stroke risk and not have to be on blood thinners or Pradaxa anymore. That's huge for me. You know, being able to go back to running and not having to worry about falling down or somebody hitting me in the chest. You know, I make jokes about it with friends. You know, hey, just don't hit me in the chest. You know, I'm on blood thinners, I might die. You know, to a certain degree, it's kind of funny, but also at the same time, it's a real life-threatening risk that if I fall down some stairs, I might not get back up.
I mean, this is true for every patient, not just Ryan, but for him probably more important because he's a young parent, so he has to take care of young kids. At the same time, he has to make sure that he can financially provide for his family, so it's actually very important.
Well, I feel really great, which is an awesome place to be. When you have atrial fibrillation, your heart isn't pumping as efficiently, and in general, you feel bad. And in general, I feel good, which is awesome.
Ryan's story, I hope, is just a way to tell people don't give up, just you have to find the right place and the right doctor.